welcome to the wrap up from day one at TCT 2020. I'm Mike Gibson. I'm joined by my good friends and colleagues, Dr. Ajay Kirtane and Dr. Roxana Mehran. Welcome, you two.
Hello.
Thanks for having us.
Well, Ajay, a great first day. I think one of the highlights for a lot of people I've heard was your live cases. You know, so often we focus on the devices, but it's great to see you focus some on the cognitive aspects of how we do these procedures, how you integrate information about physiology and imaging. Thought that was really refreshing to see you do that.
Well, thanks, Mike. I mean, certainly going back to basics is something that you taught me. So we felt that this was something that we needed to do at TCT. This came right after the opening session, which was really poignant. There were tributes to healthcare workers and essential workers. There was sort of a preview step-by-step of what to expect at the meeting, and also a dedication of the Leon Center, which is a collaboration between ACC and CRF. We went right into the live case, and that was a case that we tried to sort of pick a run-of-the-mill, everyman kind of case, or every person kind of case, to illustrate how we should think about these cases and how we ought to be thinking about doing PCI in the current age. So not just pure angiography, thinking about physiology, how imaging can change what you do during the case. And something that I feel pretty strongly about, and somebody picked up afterwards, is that you want to do the best possible job you can for the patient, so when they leave the table, they don't have to come back, they're set, and that's what we try to illustrate. Many people think of complex PCI as all these devices and techniques and that sort of thing, but a lot of it's cognitive, and we hope to sort of illustrate that, kind of like our PCR colleagues try to do in Europe.
Yeah, you know, the technology is so good that anybody can put a stent anywhere now. You know, it really is the decision-making, I think, that's really paramount at this point. Roxana, some great things came out today from the FDA town hall. Talk to us a little bit about that.
The FDA town hall today, as you know, first of all, thank you for inviting me to your party. This is your party, and I'm really glad to be part of this.
You know, you were invited.
And I can't leave without saying how much I enjoyed Ajay with his live case. I'm sorry, I'm coming back to that, because what he did is to show the art of the science at working. You know, every clinical trial that was there incorporated somewhat into a physiology and imaging guided complex PCI. I won't call it chip, complex PCI with a very, very difficult case that was done step by step. And he was basically translating his brain and how his thought processes was to the audience. I just thought it was fantastic. It was really, really great. I loved it, and it's exactly right, and that's what we owe the patient, to have them leave with the best possible results. Congratulations on your wonderful, masterful work. I don't care what you say about the diagonal branching, you know, wiring.
I couldn't wire it
as much as it is, but then of course today's the opening of the FDA town hall as well, and you know that for us is FDA. They're our partners. They keep us and our patients safe. They look for safe, and if we work very, very closely with them, and we're so lucky that we have the FDA. The town hall is a place where we get to talk openly about anything we want. And so in the opening session, Dr. Leon and Bram Zuckerman are leading this, with Jeff Shoren giving an opening address regarding what's going on at the FDA, the COVID-related issues for device approval, for patient enrollment, the kinds of things that we all are extremely worried about. And what is the FDA doing to keep the level of the science and scrutiny still up there, and still having a balance of realizing how difficult it is to enroll patients and to continue the work. So they've done an incredible job. We're very, very lucky in this country to have the FDA. The town hall allows us to have a great conversation. And then of course, this today is just an opening, talking about some of these interesting valve collaboratory and heart failure collaboratory, the kinds of work, the collaboratory work that's being done between the payers, the FDA, the industry, the clinician scientists, and the clinicians in the trenches. So I'm really excited about that, and it should be a fantastic, fantastic venue.
Also, a fair amount of attention to COVID here. You know, TCT this year stands a little bit for the COVID therapeutics or something. So talk to us a little bit about that, Roxana. That was a focus as well.
Well, we had a late-breaking trial today. Tim Henry presented the NACME, the North American COVID MI Registry, which is a conglomeration, and Ajay has been involved as well because he was part of the original statement that came out immediately as COVID was coming out, and everybody was worried about how do we deal with STEMI patients, et cetera. So that was presented today. It was a very, very exciting registry that I think is going to have a lot more to say as we keep going. So you have I believe, the mechanism to collect data to follow these patients for a longer period of time. There wasn't any kind of an earth-shattering anything. I think the more we collect patients, the better we collaborate with our colleagues across the globe, not just North America. And I think those were some of the things we talked about regarding the NACME registry. But what was another wonderful thing are these 6 COVID sessions every day at TCT. There are COVID sessions where you talk about pretty much everything that's related to COVID and cardiovascular disease and complications, whether it's, anticoagulation therapy and myocardial injury, et cetera. All of it's sort of all encompassing, pulmonary embolism, et cetera. So I think those are going to be a really, really highly popular, and I think many will enjoy that conversation with all of the experts.
Yeah, I agree. And Ajay, some late-breaking trials presented today, the prospect trials, combined trial, a lot of intravascular imaging studies done today. What's your take on those?
Yeah, I think that certainly there's late-breaking trials and late-breaking clinical science, and the 3 in the late-breaking trial session looked at vulnerable plaque. And this concept of the fact that even after a patient is stabilized, the non-STEMI lesions are treated, we could then identify subgroups of patients that had a higher risk of subsequent events. Similarly, in the combined trial, patients who have FFR negative lesions, so we often think that they're completely revascularized, still those diabetic patients that had TICFA seen on OCT had an increased rate of adverse events. I think lets us really, really remember as interventionalists that we have to step out of the cath lab and be regular doctors and understand that just because we've treated the angiographic disease or even some of the imaging-based disease, these patients still have vulnerable plaques. They have a systemic disease that needs treatment. And right now that treatment is medical therapy. Prospect Absorbed was a pilot trial looking at whether stenting some of these plaques might be associated with improved outcomes, but it's a pilot study. Nobody at all is advocating to treat these lesions prophylactically,
right,
unless we have a randomized trial data with much, much larger number of patients in order to sort out whether that's beneficial. So that was kind of the late-breaking trials. Late-breaking science, there was a number of things. One I thought was pretty interesting, and I'm sure Roxana feels similarly about this, was the sub-study of the TICO trial, TICO STEMI, which looked at dropping aspirin 3 months after being on aspirin and ticagrelor in STEMI patients. And as we'd expect, less bleeding by dropping aspirin and no increase in ischemic events, which is, I think, reassuring, although this is a sub-study and not independently powered. There was some other data as well that was presented. And what's nice about this meeting is everything's on demand. So you can go back and look at the presentations later. Everything's downloadable on TCTMD in terms of the slides, et cetera.
And also a study of crushed prasugrel really didn't show any benefit in looking at ST resolution or TIMI grade 3 flow pre-treatment in STEMI, similar to what Gilles Montelesco showed with ticagrelor. So, again, supporting what the guidelines said from ESC, that there's not a lot of benefit with a thienopyridine preloading in some of these scenarios. I wasn't really surprised to see that. Really, the thienopyridines prevent platelet activation and recurrent thrombosis, like stent thrombosis in Gilles' work, and recurrent MI, but not a lot there to disaggregate existing platelets. Were you guys surprised by the result?
I wasn't. And just one thing I'll say real quick that I learned, probably the most important thing from that study, is that I think the patients really hated it because it tasted really bad. So there we go.
Not past the Pepsi challenge. I mean, it did not taste better.
The platelet reactivity was better. It was less, there was a quicker onset of action. But again, this was very similar to Gilles' study. These were the kinds of patients who got to the cath lab within an hour or so, or a couple of hours from presentation to the cath lab. And I think that's really kind of speaks for if you're going to see any kind of a pre-treatment work. I don't think we should say no pre-treatment ever for anyone, because I think there are those patients who just don't get to the cath lab fast enough where there could be some benefit. But I mean, I was, you know, with 700 patients, ST resolution, and open artery, infarct-related artery, and I think that obviously didn't work, but I wasn't so surprised with those endpoints, honestly.
So great day one. Ajay, what do we have coming up tomorrow?
Well, I think it's going to be great. Again, we now have the part 2 of the Columbia cases tomorrow. And so my good friend and our good friend Dimitri is going to be doing a really complicated case that he makes, I'm sure, going to look easy, because that's just how he does things. And so that's why we felt it was a good bookend for our cases. And Roxana, I think, moderated the press conference for the light-breaking trials for tomorrow, so she can perhaps preview those and let people know what to expect.
You know, the late-breaking trials tomorrow are very, very exciting, Mike. We're going to see the results of the Corrado Tamburino is going to show us the results of the accurate neo valve versus core valve. This is a 1-year results, 30-day results, over 700 patients randomized to a valve versus valve, and very exciting to see that. Then there is also a very interesting little study that I really liked is post-mitral clip closing the ASD versus not, the ASD, the iatrogenic ASD that you create. So that's also very interesting. And Jeff Moses is going to talk about the TriGuard embolic protection device. That's going to be, that's been a study that's been ongoing, and it's an important, I think, understanding how can you use a different embolic protection system to protect against neurologic complications during or after, immediately after TAVR. And then in the clinical trial, in the science area, I'll be presenting the Science 90 and Science 28. Dean Kariakis is going to present the Disrupt CAD study, which is the use of the balloon, the shockwave balloon. And that's kind of exciting. It's a single arm study, but it's pretty exciting. It's another, you know, you need these new kids on the block to kind of try to have all of that. So there's a lot of great studies that are coming up tomorrow.
I've never been a big fan of distal embolization with atherectomy devices, so Ajay knows that. So I'm pretty excited to see the results of the shock.
No, it'll be exciting.
Yeah. Well, great first day. Congratulations, Ajay, and to everyone at CRF for making the transition from a live meeting to a virtual meeting. I think you've been very, very successful. Congratulations. And look forward to chatting with the two of you tomorrow.
Thanks, Mike.
Thank you, Mike.
Bye-bye now. Thanks, everybody, for joining us.